So we're the Scarborough Hospital MDT team, part of York Teaching Hospitals Trust. We're doing this in a very socially distanced way, with some of our team not able to be here today, and others having to work from home due to the effects of the ongoing situation. So who are we? If we move on to the next slide, we should have our socially distanced team photo. And so there's myself, who's the lead consultant for the team across in Scarborough. We then have Sarah, who's our QI champion at the team. We've got Suzanne as our PDSN, Kathy Ann, our dietitian, Joe, our clinical psychologist, and Kelly, who's our support worker, admin and general tech genius, who sorts us all out and keeps us in line along the way. So following the last session as well, then we thought about what our purpose was in the last session. And this is something that I think we're going to keep revisiting as we go through this journey. And really, it's about establishing those positive relationships with children and young people with diabetes and their support networks, and helping to provide support and education to enable them to achieve their full potential as they move towards adulthood as well. So now hand over to Sarah to talk about our kind of journey so far.
Okay, so we'd started off by the initial thing we'd wanted to focus on as part of the QI project was the education that we offered, because when sort of we were coming to us with a sort of higher HbA1c and what we sort of do about it. So we looked at what sort of patterns we were showing, what variation, what we were doing already. Because the feeling was that actually we were doing this already, and that everybody was getting a similar service. And when we looked at, so we took did a random sample of patients who we'd offered sort of specific high HbA1c advice about, and we found that although they did get all of the patients got all the interventions in the end, is that the level and the time of those interventions varied quite dramatically between patients, and that was sort of depending on which team members had been involved and also how we were interpreting the engagement of the family. One of the strategies that we would also use is having a planned ward admission to just sort of give ourselves really an idea of what the controls like and how the young person was managing their diabetes. And we'd found that although we as a team found that was useful and generally allowed us to actually ensure that the insulin doses were correct, that this wasn't of much educational value for the children and young people. So we wanted to look at how we could change that and what we could do instead to make that a better or sort of more positive experience for them. So although that was our original aim, we realised that we couldn't sort of just look at the education on its own, and that we actually probably needed to revisit our whole HbA1c policy. And something that we sort of got stuck on quite for a long period of time as a team was, at what point do we say that somebody's got a high HbA1c, and thought a lot about sort of the language that we used around talking about blood glucose levels and HbA1cs, because for actually for some people, HbA1c of 58 millimoles would be great for some of our young people. For some people, it would be almost a disaster. So how we reflected that in the language that we used, and what point we were putting the interventions in. So we've sort of started looking at a different way of talking about HbA1cs, looking at more as an individual person's trajectory, rather than actually what the number is. And obviously this will be affecting how we manage things in clinic and at what point we put in the interventions. And so I think similar to some of the other areas, struggled with how we make that into a smart aim, and then how we measure it. One of the things we're sort of considering is just looking at overall sort of clinic experience, using a sort of questionnaire that we ask young people and their families to fill in at the end of the clinic to say, actually, how was your clinic experience? Did you feel listened to? Did it feel like a positive experience, or was it negative? Again, I think that's sort of just some things that I've already spoken about in terms of, sort of the different types of diabetes and the HbA1c trajectory, and looking at how we change the patterns for the young people when we see what can we do differently, rather than sort of offering just doing the same things always because we have to. I think it's about trying to really target that sort of focused into education, sort of getting the right intervention at the right time. And some of the other things we've been kind of doing along the way is we've done a SurveyMonkey, looking at what our young people want out of the diabetes service. We recognise that this is what we think we need to do, but actually does that reflect what they want? Because actually, if it's not what they want, then there's really not a huge amount of point in doing it and changing it. How we increase their participation in clinic discussions, talking about actually what an HbA1c is, why we're doing it. And also, I think along with other people, kind of really promoting the use of DigiBete. So, and I think we've probably not had as much structure as some of the other teams have shown, but have sort of been working through that mainly sort of on a flip chart basis rather than just as a so that we haven't had the skills to get onto PowerPoint.